Women have a lot of misconceptions about breastfeeding today, a lot in part because a lot of our patients' moms did not breastfeed. Breastfeeding kind of fell out of vogue and out of use as formula makers really started promoting formula and pushing formula. And so our women, it's kind of a lost skill. So women have a lot of questions that they didn't have 30 years ago or 40 years ago because their moms breastfed. For instance, women will say, I have to go back to work in 6 weeks. What do you tell them?
You can still breastfeed when you're going back to work.
You can. You can tailor your breast milk. You can breast and bottle feed. You can tailor your breast milk. Your body will adjust, too, to what you need. Women will say, but what if my baby gets teeth?
And that's okay.
It is okay, because babies don't bite when they feed. They more suck like they would on a bottle. Women will say, I don't want to expose my breast in public. That's a big thing that we get. And what do you say?
Then you don't have to. There's many, you can if you want to, but I mean, you can be as discreet as you want with it, and you can always have a blanket or a little, sheet over you, but it can be a very discreet process.
Here in Wisconsin, we actually have a law that gives women the right to breastfeed in public. So if anyone says to you, you shouldn't do that or that's against the law, that's not true. It's actually supported by the law in Wisconsin.
It's something that needs to be brought back into seeing it as a natural process, to normalize it so that the community encourages it and is happy when they see a mother taking such good care of her baby.
I think one of the problems with breastfeeding too with new moms though is we think breastfeeding is a normal kind of thing, but it still has to be learned by moms and babies. So moms will breastfeed for a couple days and say, oh, I can't do this, my baby won't latch on. But your baby will eventually latch on. Your baby will get what he or she needs. Here at the Aurora Midwifery and Wellness Center, we have 15 nurse midwives and 2 nurses, all of whom are really knowledgeable in breastfeeding. One of our nurse midwives is actually a certified lactation consultant. So if we have moms who have problems beyond the regular problems of latch, we can always make them an appointment with our certified lactation consultant. Our nurses can answer questions on triage on the phone, so if a mom has a question and calls in, we're happy to. We are the experts on normal top birth and breastfeeding.
They'll get a visit from a lactation consultant in the hospital too, so once they've delivered, they do get a visit from them in the hospital. So just to kind of, see who is available to help, and that's just like a great resource to help encourage the process along the way when any bumps come up.